Hello, good afternoon, and welcome to this live podcast here in Nashville, Tennessee from our 2023 National Conference. My name is Marzia Fatima from the podcast team here at eClinicalWorks. With changing technology and so much data in our database these days, it's hard to manage our own servers. eClinicalWorks recently signed a contract with Microsoft, who's hosting all of our cloud customers and storing the data over there. With this recent change here with us is Ashley Nixon with Carson Medical Group. Hi, Ashley. How are you?
Good. How are you doing?
Thank you. I'm good. Tell us a little bit about your practice.
So we have a little over 50 providers, and we've been in practice, I believe, since 1974. So it's been quite some time.
Yeah.
And we're multi-specialty. We have OBGYN, pediatrics, and we have family practice and an ENT provider.
Amazing. Mm-hmm. All right. And how long have you been with Carson Medical?
I have been with Carson Medical Group for 9 years.
Oh, amazing. That's great. Mm-hmm. All right. So tell us a little bit about your move to cloud. You recently moved over to cloud. How was the experience overall?
I thought it was great. It went really smooth. The support was just awesome with eClinicalWorks, which was great. Yeah.
All right. And when did you make that switch?
We made that switch, I believe it was a little over a year ago.
Okay, so not too long ago. All right. Have you seen reduction in costs and improved workflows, improving efficiency with that?
Oh, yes, we have.
All right.
It was great. I wish we would have moved over sooner, to be quite honest with you.
Okay, all right.
Definitely with logistics. So we would always have to do a lot of coordination and planning for every upgrade. We'd have a lot of IT resources that would come in. People would be coming in after hours, on the weekends, and that's not cost effective. We know that, right?
True.
And then since it always was such a process, we were hesitant to upgrade. So at times we would wait and we would hold back until we absolutely had to upgrade. And in doing that, we would miss out on enhancements, right? Because we're waiting, bug fixes, and so that's not good for our end users. They needed to get those bug fixes or even patches like our Medispan content, things like that. We would wait until we absolutely had to do it. And so for the end users' workflows, it just wasn't efficient.
Makes sense. And with even, like you said, even with patches, you had to have human intervention with every machine to do that upgrade with you. That makes sense. So talking about enhancements reminds me of Prisma. I know you're not fully utilizing it across the board, but share your experience with some of the providers who are using Prisma currently.
Yeah. I love Prisma because it is so easy to set up. I mean, it's just a few clicks to get yourself set up.
Correct.
And there's no cost with the Commonwealth and Carry Quality. Data is just there. It's at your fingertips. I would like to share our experience with a particular or two particular providers at our practice. We'd like to implement Prisma with all our providers, but right now, locally, we kind of had interfaces and things already in place. And so we were doing okay. But then we branched out and we opened up a new facility in Reno, Nevada, which is a larger community than we're in. And with this, we had two providers come from a really large health system. And when they first started, it was just a terrible, awful, icky workflow. Our poor providers were actually taking two computers and logging on to this other health system's portal and eClinicalWorks and manually entering data.
I can't imagine.
That's terrible. Terrible icky, right? Just no. So with very little training, because again, we were just low on resources, we had a lot going on, I said, we got to do something. And I knew about Prisma, I'd used it a little bit. So I just showed our providers, kind of crash course training on it, which we don't like to do usually, but it was just so intuitive and easy. And the first time that we did it, so we had to get consent, which that wasn't that bad to capture the consent. But once we got that consent, it was just there. I mean, just right there. Yep. I don't even want to say fingertips, at your right chart panel.
Yep.
Right? So the providers were like, this is my last progress note in that health system with my patient. And so it wasn't even just like copy and paste. No, this was structured data. And structured meaning it's coming into medications, histories, problem lists. And they're able, their MA just flick it right over into the progress note. So the chart prep, I mean, it just going from 2 computers, manual entry, right? Which safety with that kind of stuff too.
There you go.
The safety improved, and their workflows improved. And then obviously our patients' healthcare improves, right?
Definitely.
Because it's right there. So
Yep,
it was
you're
awesome.
able to treat patients faster, right? You're not waiting for somebody to fax over the document to
Yeah.
you. Someone goes through that fax box. It makes it really, really quick. Speaking of data coming in through Prisma, you also have a lot of data of your own within your database. I know you guys are using Patient Portal. How are you transmitting, or what kind of data are you uploading on Patient Portal, and how are your patients utilizing it? Have you seen reduction in phone calls? How's that working out?
Yeah, it's really working out. And you touched on it that Prisma, we can look at our own data too.
Yeah.
And we had a very oddball request, not an oddball provider, but oddball request.
Okay.
He asked me to find some term that he had put in a chart. And I'm like, are you serious? How am I going to find this needle in the haystack, right?
Yeah.
And so with Prisma, I just typed in the term, and I was able to search our own progress notes and find it. Made me look really smart, made me feel good, right?
Yeah.
Thank you, eClinicalWorks. But no, that was awesome. So I thought I had to share that. But
awesome. That's great.
with Patient Portal, with the Cures Act, at first we were kind of scared, like all this new information blocking and all these things. But it really opened up this avenue in this way to engage patients, where we are putting letters, forms, FMLA paperwork, things like this, right to their patient portals via the documents. And for a patient, you don't have to come in or another phone call to the office or whatever it is. It's right on your device. So if it is that work excuse or a school excuse or whatever it is, you've got it right there in your hands. And with the pediatric population, we have busy parents. They don't have time to come in and do stuff. So I feel just that piece has been amazing. And then for our medical records now, we're not giving options of printed. I mean, we'll give them a printout if they want, but we're sending it electronically. So again, it's right there. It's easy. They can get it on their device. In addition to the features that have always been there, right? Visit summaries, things like that. And I think going back to that patient safety as well, at
Correct.
first we thought putting that entire progress note out there, scary, right?
Yeah. Yep.
But you know what? It really helps because patients can see their own records and they could catch errors.
There you go.
And we
Yeah.
have that. We actually had it with an employee,
Oh,
but
wow.
they caught an error, and it wasn't a major error, but it could be corrected, right? And
you
so now that patients have that data, they're empowered, and
that.
now they're more engaged in their healthcare, which is great.
Yep, and they're aware of what's going on with their health, and patient satisfaction goes up, right? I have all of the information I need without having to wait on hold for 5 minutes
Yep.
for somebody to answer. Well, thank you so much for that information. I think this was great for everybody to take home and apply in their practices. From the eClinicalWorks podcast team, this is Marzia Fatima. If you want to watch more eClinicalWorks podcasts, you can find them on YouTube, iTunes, Spotify, and my.eclinicalworks.com. Thank you so much for joining us. Have a good day.